So I'm Emily, and then this is my husband, Justin. This is Hattie. We live in Edina.
Hi, my name is Anna Granius. I live in Minneapolis, Minnesota, and I just gave birth to a baby boy on April 8th.
We decided to switch from a hospital birth to a home birth at 38 weeks pregnant.
I had been planning a birth at a hospital, and because at 37 weeks, because of COVID, I changed my plan to a birth center.
While roughly 99% of births in the United States take place at the hospital, COVID-19 has many pregnant women, including myself, reconsidering where they want to give birth. I talked to my doctor a couple weeks ago on this program and was reassured that the hospital is still a safe option for me during this time. However, I wanted to hear from a couple women who felt compelled by this pandemic to change their birth plans.
So in the beginning of our pregnancy, we were the type that would have never even entertained the idea of a home birth.
I think COVID kind of crept out of nowhere to really disrupt what felt like this kind of perfect bubble of anticipation we were living in.
It was why do I want to go to the hospital, where all the sick patients are going?
Pretty soon we were hearing that only one support person could be at the hospital, and that was hugely upsetting to me. Felt kind of devastating for a day. I was like, what are we gonna do? We both have never done this before.
At that point I was like, oh my gosh, is it really possible, or should I switch to a home birth? The thought of it was a lot more comforting to me, but it was also really intimidating because I was only 2 weeks from our due date, and I didn't know if it was going to even be possible to switch.
That was a big red flag for us. Okay, maybe we need to actually consider other options. So we did.
I'm Pat Hink. I am a certified nurse midwife. This last year, I took on the director role here at the Minnesota Birth Center.
I'm Emmy Corbet. I'm a certified professional midwife. I provide home birth and care for newborns and new parents.
My name is Rebecca Polston. I am a midwife and the owner of Roots Community Birth Center in Minneapolis, Minnesota.
What is a birth center? It's a freestanding clinic birth place where women can go.
We provide comprehensive prenatal care, birth in our facility, not in a hospital, and comprehensive postpartum care for both the birthing parent and their children.
So a home birth is literally just somebody deciding to have their baby in their house. There's been multiple studies done over the years that prove that home birth is safe as long as you have a trained attendant and a low-risk birthing person.
So in general, we serve low-risk birthing people. So that means one baby, head down, no more than one C-section, no other underlying health concerns.
We have been getting a lot of inquiries of transferring care to us, fear of COVID in the hospital.
And our hospital colleagues are making the very, very good decision to limit the number of people in. We all are.
We screen everyone. We don't have anyone with symptoms coming into our center. We screen the staff. And so we have a little more flexibility, I think, but we do limit somewhat. So in a birth, we, the partner and a doula. So there would be two with the laboring woman.
I am really feeling like if someone is low risk and they've had good prenatal care and there's no red flags, I am accepting people later than I normally would.
Yeah, I think my birth went better than it might have at the hospital because I was so much more calm being at home, and it's just that feeling that your body can do what it needs to do better. You need to not be super stressed out in your environment in order for your body to open up and just kind of do what it needs to do.
There's always a continual assessment of a person's risk factors. And as long as things stay low risk, then we can stay home. Knowing that, lots of complications can be slowly evolving. And we're also trying to call 911, if a situation is not within our scope and, the situation is not low risk, then we call for help and we accompany that family to the hospital.
So I went with the Minnesota Birth Center. So it felt really good in there, but I was not able to keep liquids or food down. So we were at the birth center for, I don't know, maybe 6 hours or something. It was about 1:30 in the morning. And the midwife kind of came and talked to us and said, you know, this might be a time to consider being transferred, mostly because you can't keep anything down and I'm worried about fatigue. And I was like, yeah, I can't do this. You know, I was pretty much delirious.
The midwife model is very low intervention. We only intervene medically if we have to, and work with the woman to make decisions about their birth plan.
In your birthing time, we monitor the baby at regular intervals, all according to what evidence says is best practice. We do the birthing person's vitals, and we can handle most of those minor emergencies in the birth center when they happen. If we need to go in, we have relationships with our local hospitals.
But I did end up going from the birth center to a hospital with an epidural, pushing, vacuum assist, and a C-section. The care was just incredible in every place that we were, and our doula at our house was great, and it's just the way things went. So, you know, I'm having a hard time getting over parts of my labor, I think, but there was still beauty in the OR. And we have this amazing picture of the three of us in the OR that I don't even know how it looks so good because I was still in such a terrible state, but I was so happy, so happy. I mean, it was kind of like while we were in that bubble, the fear of COVID and the pandemic kind of melted away for a little while. And from there on out, I mean, it really has been just a total joy.
Being pregnant in general comes with a ton of difficult and anxiety-producing decisions. Pile on top of that a pandemic and so many more unknowns, and these decisions can feel absolutely terrifying. Ultimately, though, whatever personal decision we decide to make about where the best place is for us to birth our babies, these conversations have taught me that there are people, organizations, and resources here to help us along the way. To learn more about these resources from community birth experts and also how hospitals are continuing to protect birthing people during this time, go to tptoriginals.org and stay tuned for an upcoming episode where we discuss the link between race and maternal mortality and how community birth is trying to address some of these inequities.